what was the most appropriate diagnostic test to confirm the suspected condition? Okay, so then I'm gonna just read through these: chest X-ray, CT, okay, EGD, contrast, MRI. All right. So a 45-year-old man, history of alcoholism, presents to the emergency department, severe chest pain, vomiting after having and drinking. Reports vomiting forcefully after consuming a large meal. Examination is tachycardic, hypotensive. Breath sounds are diminished on the left side. He has subcutaneous emphysema in the neck. Okay. Like we said, the diagnosis here could be. It doesn't say that he vomited blood, right? No. Okay. The subcutaneous emphysema in the neck, not his lung. So if it was his lung, I would think like aspiration pneumonia. I don't think that that's going on. So I'd get rid of chest X-ray.
So what's the diagnosis that you think?
Um,
So I want to kind of get you to force yourself to kind of
okay.
say, I want to commit to a diagnosis here.
I'm not sure what the diagnosis could be. I'm really not sure. I'm like, it could be like the ruptured esophagus.
Okay, good. I like that.
Um,
Okay.
it could be, that's kind of all I could think of if it's
Okay, good.
forceful vomiting. There's another word for it. I just can't remember what it's called.
That's okay. Let's just call it ruptured esophagus. So let's say you
Okay.
know you think the diagnosis is ruptured esophagus. How do I confirm that? What do you want to run to confirm that?
Um, I mean, I don't think you'd want to do, I mean, with contrast, you'd see if there's bleeding. If you'd stick something down, like um, the endoscopy might be dangerous if it's bleeding. A CT would show this, I think, pretty well. An MRI might be too much right now. I know contrast would show it, but I'm just not sure how to. I don't know if they're going for cheapest. I don't know if they're going for quickest.
Okay.
I mean, an X-ray could show something, but it also could not. So it could be um, like a waste. So I'm not too sure.
Okay. So you're between CT and esophagram, it seems like. Okay. So
Yeah, I think so. I
okay.
think a CT of the chest could show them would show the most. And it because then I think with contrast with that, you'd have to either swallow it, or if you can't swallow something, and then he has the emphysema in his neck. Um, so that could be. I'm not sure. I would, yeah, I'd go CT of the chest, but I'm really not sure.
Okay. Okay. So this is kind
Okay,
of
it was
interesting
X-ray.
here.
Okay.
So there's a couple things going on here. Okay.
Hmm.
So this question is a little bit tricky. So we'll kind of break it down first. Okay. So there's multiple things. Okay. He's an alcoholic. He threw up, right? And he most likely has a ruptured esophagus, or they call that what, Borhaver syndrome, right?
Yeah, I couldn't remember the name. Okay.
Yeah, so Borhaver syndrome, right? And it has all those risk factors, right?
Hmm.
Drinking a lot, heavy drinking, vomiting, right? And then all of a sudden, right, he has fever, tachycardia, hypotension. So this is really weird, right? Why does he have this? Breath sounds are diminished on the left side, and he has subcutaneous emphysema of the neck. So he likely ruptured his esophagus, but why a ruptured esophagus doesn't necessarily lead to a left-sided diminished sound, right? And so it
Okay.
depends on what you're trying to evaluate here. Okay, this is why this question is a little bit tricky because he has
Okay.
two diagnoses and one led to another. So he had Borhaver's or ruptured esophagus, which caused air into his mediastinum, right? Which is why he has subcutaneous emphysema of the neck, right? So that just means air under the skin, which is not supposed to be there, likely because he ruptured his esophagus. And then he has a diminished left side, right? Meaning he probably has a pneumothorax on the left side. Does it make sense? The pneumothorax
Okay.
and the collapse of his pneumothorax likely, right? Likely what ended up happening is that he had so much air come from his esophagus, it probably um, what's it called? Probably collapsed his lung. okay, versus
Okay.
pneumomediastinum. Okay, so best thing you can do, right? I mean, there's a couple things. EGD, definitely don't want to do that. If you shove a scope down the esophagus, right, it's going to rip it more, have
Mhm.
a worse outcome. Contrast, right?
Right.
Um, if that you can use contrast if chest X-ray is inconclusive, right? And
Okay.
which one do you want to use? You want to use gastrographin or you want to use barium?
I'm not sure that I don't know the difference between them.
Okay, so barium can cause mediastinitis. It's very, very inflammatory. So you want to use gastrographin, which is a little bit more easy on the
Okay.
body. It doesn't react as much. So if they ask you what kind of contrast, okay, MRI is not really kind of used for esophageal rupture, and then CT,
Okay.
right? Um, but it's not the initial diagnosis. So chest X-ray is going to be the best here to start. Okay,
Okay.
perfect. But you got the diagnosis right, right? Always start with the diagnosis. And the reason why I keep stressing that out is because if you don't start with the diagnosis, then now you're picking some scan that's, you're not targeting the scan. You know what I mean? So
Okay.